So, Kara, I would like to know what are your concerns here today with Mia?
Oh, doctor, my baby. My baby girl. Now, doctor, she's about 10 months old now. And I've noticed that she's had some developmental problems. She hasn't eaten like a normal child. She hasn't gained weight like a 10-month-old should.
Well, we're going to do some blood work tests, and I'm going to check her out. Well, as you can see right here, her chin is abnormally small, and she sort of has puffy eyelids. But since she doesn't have every feature, what we could do is do some blood work tests, and it's a new technique called FISH. So, I'm going to do her blood work. Take out some blood, and then with this blood I could test for Williams syndrome. Well, this would take about 2 to 3 weeks for the lab work to come back in. Do you have any questions if she does have Williams syndrome?
Yes, doctor. What's going to happen to her in the future?
Well,
can she walk?
Can
she talk?
She'll be able to walk, talk, eat, everything. She's just going to be more delayed than normal kids. She's going to be overly friendly. Like, very friendly. The most friendliest person that you can know. She probably will need physical therapy soon because the reason why they're delayed in physical... Well, the reason she will need therapy is because joint stiffness. And we need to give her that extra push so she'll be able to walk and talk like normal kids. She will have mild retardation.
Yeah. Really?
Yes, she would also have heart defects, unusual facial features like small upturned nose, wide mouth, small chin like we talked about, spaced out teeth, and puffy eyelids like we said. She weighed very little when she was born, right? Like 4 pounds, as I can see in the chart.
She was a baby. She was a baby.
Exactly, and she weighed a lot, very little.
It's okay,
and she has low muscle tone. That's why she's not walking, as she should not turning or sitting like she should be. And like we said, she'll be very friendly. We just did the testings, and like I said, the blood work, which we did, and then the treatments. There's no treatment for Williams syndrome. But you could go to physical therapy and speech therapy. And it all depends on how she grows up. If she doesn't have a speech problem, she doesn't have to go.
Now, doctor, why is it that my baby, she looks normal, but she just has a little bit of defects? Is there any cause in her body that made her look at least a little?
The cause is when the egg and the sperm met, the DNA molecule broke when the sperm and egg cells developed.
Okay. Now,
it's basically a genetic disease, and it can't be fixed.
Now, doctor, let me ask you this. My little baby girl here, if she would want to, have children maybe in the near future, would she possibly carry this disease?
Most likely, Williams syndrome kids do not have children because they have retardation. So they're basically always like a little 10-year-old. Like, they won't grow up. So she's not gonna have a normal life. She won't have kids. She most likely won't get married. But she will have friends.
My baby's not gonna have a normal life? Why'd you tell me that, doctor? Okay.
Okay, well, thank you, Kara and Mia, for coming. I will call you as soon as we get...
Doctor, thank you.
As soon as we get the results. But let's just hope she doesn't have it. But, Kara, I think that 99% sure she has Williams syndrome.
Oh, it's okay, baby. I still love you.
Well, I'm going to send you the referral so we can start therapy next week, Mondays and Tuesdays.
Okay. So I have to take over one day.
Okay, thank you.
You can see my nose goes from a little bit out and then it points out. For someone who has Williams syndrome, it goes flat and then out. Also, you can have puffy eyelids, gapped teeth, or a small chin.
Wide mouth.
And a wide mouth. So today is really just a great day, and as you can see, I'm wearing this wonderful t-shirt. Let's get a close-up to this. To sponsor the Williams syndrome.
Woo!
Kids with Williams syndrome tend to have eating problems. They don't like to eat very much, and they're very picky. And it's hard for them to chew.